morning, everyone. It is a mystifying title, I have to agree. But it is true nonetheless. I would like to start to show you that we are living in a fast food culture. And that means that wherever you go, if you buy a hamburger or a cup of coffee or a sandwich, you expect exactly the same quality, whether you are in New York, in Shanghai, or in Liverpool. You get exactly the same thing, right? And somehow we live today in a culture where we expect the same for anything else, also for antibodies. And particularly with research antibodies, when people need an antibody for their own purposes, they go to these large brands and they expect that what they buy is actually going to work based on the data they present on the product sheet. If it was only that simple, then we wouldn't be standing here. There has been a lot of problems, and particularly this year, these problems have become into discussion everywhere. But when I joined Everest Biotech more than 10 years ago, I quickly realized that there was a big distrust in the market for commercial research antibodies. At the time, it was clear that the vast majority of people, academics, using research antibodies rely on their own animals from their own animal facilities, and they didn't want to touch antibodies from catalogs on the market. And through customer feedbacks and through discussions on the internet, social media, I built up a picture of what was actually going on, and I noticed that it was a very complex situation where the quality of the antibodies were an issue, but also the quality of the conduct of researchers in the lab, and the quality of how antibodies are stored, etc., etc. And it all came into the mix. And ultimately, last year in October, I wrote everything down and shared it to the public in this publication in F1000 Research. And that was received extremely well, I have to say. So well, indeed, that I followed up with a second paper, more directed with relevance to clinical biomarkers, but always with the antibodies as the main subject. And also that was received well. But in the meanwhile, it became clear that I was not alone in these views. And independently, if not as a consequence of that first paper, Nature came with a series of editorials discussing exactly the issues that I raised in my first paper. And this is in reverse order, so they started in February this year about reproducibility and in relation to antibodies in the research, and discussing how not only the quality of the antibodies, but also the reporting, how the antibodies need to be reported in the papers, need to be addressed. Reproducibility, even sharper formulated here, blame it to the antibodies, clearly implying that the quality of the antibodies is so poor that there is a lot of jeopardy and a lot of negativity surrounding that, causing problems in the progress of medical science. And then it kept on going about arguing how to standardize the reporting of the antibodies and reporting of the results. And finally, and that's the most important one, the most recent one, that is a financial incentive, because the problems associated with the way research is done and also how antibodies fit into that causes the taxpayer about $28 billion per year. So for that reason, there is a lot of discussions going on at the moment, and that is why I'm here to bring up a few aspects of that particular subject. And I'm taking two of them covered by the title. One is about how antibodies prevent progress in biomedical sciences. They do, and I'm going into that. And secondly, I will also demonstrate how they actually can be used as a powerful tool. So, you know, it's not all that bad. You just have to realize these two aspects. Before I do that, for complete sake, I just need to emphasize that we are talking about research antibodies, knowing and acknowledging that there are alternatives to antibodies. In addition to antibodies used for diagnostics and for therapeutics, they usually are recombinant monoclonal antibodies. But there are alternatives on the markets as well. There are Affimers and Affibodies, basically also based on panning phage display libraries where they clone the CDRs into another protein. Rather than an immunoglobulin, they clone it into something else. For example, a protein that causes and elicit no immune response. That makes it ideal for in vivo applications. Or in another simple scaffold protein with a label on it, so it can be used for diagnostics, for example. And the advantage of these alternatives are that you can produce them in very large quantities at relatively low cost. Once you have selected for the right reagent, and that is the problem. It is very expensive to generate such product. And that also is true for aptamers, which are not proteins at all. These are oligonucleotides, chemically modified to make them stable. And they act also as if it was an antibody. They can be very specific to one particular protein, in a complex mixture or on a tissue. So you could use them for any immunological assay as an alternative to an antibody. But the same is true as for the Affimers and also for the recombinant monoclonal antibodies. You need to screen them, you need to pen libraries, you have to find the right one with the right specificity and selectivity. And that is a very costly process. And for those reasons, we're not going to cover this today because they're not relevant for the day-to-day research in the lab, where people just need an antibody for one particular purpose. You buy it from the market and you make sure that what you buy is going to be fit for purpose. And that is where we start our talk. How to make sure that you buy the right antibody so that your progress is not negatively impaired. Well, that can be a problem. And when you're shopping around, there are a number of search engines available to you. The most important, or the biggest one, the best used is BioCompare, which pretty much exhaustively has all the antibodies that are on the market. So you just type in the protein of interest, for example, AIF1, ABI1, nestrocyte biomarker. And BioCompare then returns 348 different antibodies on the market, divided over 31 different suppliers. And PIK3CA, it's breast cancer item, returns 220 antibodies over 35 different vendors. One more, the winner, FOXP3, the T-cell marker. 1,055 different antibodies on the market, over 47 different vendors. How are you going to find out which one you need? In fact, most of them, there are only 30 or so different antibodies on the market. That means that each of these antibodies are returned many, many times in the search engine. So there are repeats, but every one of them are labeled as a different brand or as a different item. So let's move on from there. Let's take the PIK3CA, for example. I've done this in March this year, so by now it might be slightly different, but it will be roughly the same. I found for PIK3C antibodies on the market, all these different vendors having all these different type of products. Acris is the winner with 16 different products. Antibodies Online and also Lifespan Biosciences both have 10 different products on their catalogs. None of those catalogs have any antibodies that were made by themselves. These are all vendors getting their products from elsewhere and putting them on the catalog. The very first one who actually makes some antibodies by themselves is Abcam. It has 9 PIK3CA antibodies on its catalog. Only 4 of them are made by themselves. And they occur in 7 different catalogs worldwide. And then Abnova has 6. One of them is made by itself, but it occurs in 5 different catalogs. Then it becomes more interesting. Novus, with also 6 products on its catalog, 3 of them manufactured by themselves, occurring in 4 different catalogs, but 2 of them are unique. 2 of these self-made Novus antibodies cannot be found in other catalogs. And that is an important observation, because that means that as a user, you want to make sure that you test those particular antibodies, because they are nowhere else to be found. If you don't buy it, you will miss out. You may miss out the most important antibody on the market that will work best in your particular platform. Okay, list goes on. Let's move on. For example, CST. I've got now. It has 3. Why did I forget what CST stands for? I forgot it now completely. It has 1 unique product, and 1 is manufactured by themselves. But it has, and then also Origin and Santa Cruz has 1 product on its catalog, and they are unique, and so you want to test those. But there's 1 standing out. That's Everest Biotech, this company I represent. It has 1 product on the catalog, but it's manufactured by Everest. Everest Biotech only has its own antibodies, doesn't take antibodies from elsewhere. This product occurs in 16 different catalogs. So even if you don't know Everest and you need a goat peptide antibody, you will find it in 16 different catalogs. So it's most likely you will find it anyway. And that is how we make our business work. Let's move on with another example. Here is the AI1, the astrocyte microglial marker. When we look at the Acris catalog with the most different returns of antibodies, the largest catalog there is, basically, on the market. What we see here are 3 goat antibodies, 3 different ones, each coming from the same manufacturer. However, they occur 4 to 5 times on its catalog. And there's also another one, and there are others that are only once on the catalog, but I want to pay a little attention to an example of a mouse monoclonal antibody that occurs twice in this particular catalog, simply because there's no manufacturer. There are monoclonal antibodies out there that are not manufactured commercially. They are being licensed in from an academic group. And that group might license them out to different vendors. So what will happen is, because it occurred twice in this particular catalog, it means that it came from 2 different sources. Maybe one directly from the academic source and one from a catalog who also licenses in from that same source. That is what's happening. And this is not unique for Acris. All the others are doing it too. they are buying products from each other's catalogs and put them together. And that is how you get situations like this, that an antibody, a single antibody, can occur in many shapes and forms on different catalogs, but it is still the exact same antibody. And that is what we call the world of the OEM, originally standing for the original equipment manufacturer. But of course, that's not relevant for this sort of thing. You see it also in insurance companies. You buy an insurance product from a vendor. You think it's theirs, but it's not. And only when you make a claim, turns out that it's coming from elsewhere. It's a very common feature, and it's also the case for the antibody trade. And it means one manufacturer with one product showing as different brands on the market. And this has consequences, because it means that the QC data that you see on the product sheet, they could come from the original manufacturer, but it could also come from customers, from the vendor that you buy it from. It could come from the QC department from that vendor. It could also come from another vendor that they bought it from, and that vendor bought it from the original source. And then, you could get different products on the same catalog with different QC data, seeming that they are different. And that is a relevant matter of concern, particularly when we are dealing with polyclonal antibodies, particularly polyclonal antibodies raised against entire proteins. Because what then happens is that one rabbit will make one antibody with specific characteristics. The rabbit dies, it's being replaced by another. Vendor 1 may change the QC data for the new rabbit, but vendor 2 doesn't, because vendor 2 bought it from vendor 3, who bought it from vendor 1, who bought it from the original source. And so what you get is a mixture of a product on different catalogs of one particular rabbit, or from another rabbit as well, with the same catalog number, but then with different data or with the same data. And the problem is, of course, when the old data of the previous rabbit was used, then when you buy the product and you want to reproduce the data on the product sheet, it won't happen because it was not the same rabbit. And then people feel deceived. And that is a cause of distrust in the market. So there's a responsibility for the vendors there. So QC data can be coming from different animals. QC data can come from customers or from the QC department. All that makes the product seem different from the exact same product coming from a different catalog. And what I've just discovered, there's the rebranding where one catalog obtains the items from another rebranding catalog. So you get each product 3 to 5 times visible as if they were different products, and they're not. And this is a pain for the user, because if you need, say, 10 antibodies from the market in order to find out which one works best, and you are not aware of this, you run the risk of having 2 or 3 identical antibodies bought in without knowing it, because you thought they were all different, and they're not. Okay, so this is how progress in biomedical science can be prevented, because there are too many uncertainties and there are too many problems how to buy an antibody, not knowing how it works. In addition to the problems within the lab itself, a lot of misunderstanding on how to dilute an antibody, realizing that each species needs another secondary antibody. You will be surprised how often we get the question, the antibody doesn't work, why? Well, you used an anti-rabbit antibody as a secondary, and we sell only goat antibodies, so it doesn't work, does it? That way. So that sort of thing also play a role. But I'd like to move on now with a more positive twist to it. how we can use antibodies as a powerful tool. And for that, I just need to go back to basics for a second. Please bear with me. We all know about monoclonal antibodies and what they are. It's a single molecule, a single antibody binding to one particular part of the protein of interest, in contrast to a polyclonal antibody. But what lots of people don't realize is that we don't have only one type of polyclonal antibody. The ones that we all have in mind when we talk about polyclonal antibodies are these guys, raised against the entire protein. And yes, they are a mixture of all sorts of affinities and specificities. For each part of the protein that is antigenic, there will be an antibody binding to it with a certain strength. And the problem with that sort of product is indeed that the chances that a number of these molecules bind to a part of the protein sharing its sequence with a related protein is extremely high. And when a number of these antibodies bind to a part of the protein that is highly conserved and present in other related proteins as well, means that these antibodies will cross-react with the other related proteins, obviously. And if you run an assay where cross-reactivity is a major concern, then you want to stay away from this type of polyclonal antibodies. Don't ever use them. That, of course, is different when you take a polyclonal antibody raised against a fragment of a protein, a fragment that's unique, that doesn't share anything with other related proteins. If you use that as the antigen, then you get also a mixture of antibodies, but they're all unique, so there won't be any cross-reactivity, which is, of course, a lot better. It's still a polyclonal, and there's still a risk of running into variations from animal to animal, because one individual makes more of this and less of this, and the next animal makes more of this and less of this, and then the characteristics will be slightly different yet again because of the size of that fragment. That risk is running to a minimum when you make use of a small peptide, typically 10 to 15 amino acids long. That is small and large enough to get a high specificity, a high affinity, but in this case, it doesn't matter anymore if in one animal you get more of this and less of this, and in the next animal you get more of this and less of this, because the size of the peptide is so small that the mixture will always be the same, and it will approach the ideal situation of the monoclonal antibody, although it's still a polyclonal. But the advantage is you know upfront the sequence of this particular peptide. So you can double check yourself whether that sequence is fit for purpose to your end when you need it. Particularly when you cannot find a monoclonal antibody fit for purpose, this is the best alternative, a peptide-generated polyclonal antibody. And there are also lots of monoclonal antibodies on the market where the epitope is not known. You simply do not know what part of the protein of interest is involved in the binding of that monoclonal antibody. And I don't want to dismiss all of those because they have been used for decades and they have proven themselves pretty well. However, I want to close this presentation with this example, and it's not unique, trust me. These are diagnostic antibodies validated and tested long time ago, went through a very rigorous procedure before they were allowed even by the FDA to come onto the market as a diagnostic for HER2 breast cancer. 3 commercial products, antibodies against HER2 receptor. And only in 2010, someone decided to test them for cross-reactivity to other related proteins. And it turns out that out of those 3, 2 of them were in fact cross-reactive to a related receptor, HER4. Now, the knowledge of breast cancer is not that far advanced to know, but you can imagine that when a patient has elevated HER4 levels and doesn't suffer from any type of cancer at all, that patient will turn out positive when these antibodies were used in the test and would be exposed to all the medical procedures in place, let alone the stress the patient will be exposed to having diagnosed breast cancer, while it wasn't, because it was a HER4 elevated and not HER2 elevated levels. You see, so not good at all. And this is all down to the fact that these monoclonal antibodies weren't fully characterized. One didn't know the epitope the antibody bound to. For me, that's a crime. Okay? So what I want to close is with the conclusion. Stay away from antibodies that you do not know what it binds to. Use antibodies that you absolutely know what it does, so there's no confusion that where it binds to. You want to make use of antibodies that you're sure of there's no cross-reactivity with anything else. That is the definition of specificity and selectivity. And when we take that into regard and we understand how the market works, all of a sudden antibodies become an extremely useful and powerful tool for your research. And that is what I wanted to share.
Well, thank you very much. That was fascinating. I've got a dozen questions, but any questions from the audience? Yes.
I have a question regarding the peptide generating antibodies.
Yes.
So how can you make sure that the conformational epitope is preserved? I mean, because peptides, even if it's part of a protein, it's still a small fragment, so and the secondary structure is probably not the same.
Not present.
And so exactly not present. So how can you make sure that the antibodies that you generated to the peptide actually work in your native protein?
By testing it.
Yes.
And-
I mean, could it be that none of them work, and then you basically?
No. We know we have Everest, Biotech have, well, all our products are peptide generated cold antibodies. And we have many antibodies positively confirmed in ELISA, in immunohistochemistry, in immunocytochemistry, immunoprecipitations, also on the native conditions, etc. And even a few in flow cytometry. This demonstrates that peptide antibodies, albeit they're linear, they do work. Not all of them, but some of them will work on natively folded proteins. Having said that, there is this concept, and I still am a bit doubtful about it, about secondary structures forming an epitope. The idea being that different parts of the protein comes together on a natively folded protein, forming one epitope that the antibody binds to. Obviously, such antibodies can never be made by a single peptide. So that sort of antibodies, if they exist, and the entire world is convinced that they exist. I am one of the few who don't. But that sort of antibodies can never be made by a peptide generated antibody. Never. What we can do is, and that explains how that feature starts to occur, is that at the time when those observations were made, one didn't know much about post-translational modifications. And what we do know now is that there are all sorts of modifications. There are methylations, acetylations, phosphorylations, you name it. Glycosylations as well. And yes, there are some antibodies that would bind to such a modified antibody. Doesn't explain anything coming from anywhere, but I don't believe that. Based on the immunology that we know, it's impossible, but people still claim that these antibodies exist. But when you ask for the literature, they refer back to papers from 15 to 20 years ago when post-translation modifications weren't that clear yet. So, that's basically the answer to your question. Yes, sir.
Yes, very nice talk. So it's kind of interesting that I think it's most obvious, I think, to people in the antibody community that the current antibodies have to be characterised better, and perhaps there even needs to be a systematic generation of antibodies. But I bumped into Andrew Bradbury at a meeting about 6 months ago, and he's quite pessimistic actually about getting public funds to actually do the work. Because the papers that have come out in the last year are almost like manifestos, aren't they, to actually generate interest in actually getting funding for either the characterisation of existing antibodies or systematic generation.
Yeah.
But Andrew was quite pessimistic last time because I think that the NIH have just had a cut, haven't they, in their budgets?
And I agree with Andy. I think a national or international approach to start characterizing all antibodies is kind of pointless, because each individual researcher needs an antibody for their own particular case, and it will be different from the next one, different from the next one, this one, from this one. It's impossible to do all these different types of characterizations, and it would be a waste of time. It would be much more efficient if the user himself will test an X number of antibodies from the market on his or her system and see which one works best, and then go for that one.
I'm going to jump in with a question here. Excuse me. Well, we will, but it's in this context. But wait, aren't there some particular standards we could begin to establish either through industry consortiums? It doesn't have to be a regulatory, but it could be some standards organization. I mean, it doesn't have to be that there has to be a dozen different assays and characterization to the nth degree, but are there some few things that you think, for example, are most egregious in the current repertoire, commercially available repertoire, that we could address? What about that?
Yeah, well, like I said, the message that I want to bring across today is to avoid antibodies that you do not know the epitope of. So that would rule out all the polyclonal antibodies based against the entire protein or a large fragment thereof. You don't know what you're buying, basically, and it might still work in particular applications. And any researcher who needs an antibody just to double check something in a Western blot, that will be fine, no problem. But as soon as you need an antibody for the mid-long term, for all sorts of different things, or you need it for the long term and you need to have consistency throughout, then you simply cannot use that type of antibody. So that's one measure, and it's very hard to convince the world for that, because the vast majority of research antibodies are polyclonal antibodies raised against the entire protein. Go figures, go start telling the world, don't use them anymore. I get all the traders on my roof.
Well, maybe even then a nomenclature. We have monoclonal and polyclonal,
yeah.
But maybe we could develop a nomenclature so that when a company sells an antibody, it has a particular term, and you know then the degree of understanding and presentation that's available on what you're buying.
Yeah, I agree, and we should head for that. In addition, to that is we need to introduce more consistency in the way researchers publish the antibodies that they use for their research.
So with this nomenclature, that could be
that
force
would
someone.
Force someone to do so. But at the moment, it's still the case that an antibody is mentioned in a paper as being a rabbit antibody from ABCAM. Well, there are 5 or 6 rabbit antibodies in the ABCAM catalog. Which one is it? No one will be able to reproduce the data on the paper. That makes the paper entirely useless and worthless. And it should not even be accepted by the publisher. And so one of the measures is to force the publishers to reject any paper that doesn't report the antibody to the tiniest detail that they use. As soon as we do that, we already bring the entire quality of research up by an order of magnitude.
So you could see ICH or someone establishing some nomenclature for the degree of characterization, then even some type of registration number, a unique number registered somewhere. So
that does exist. It does exist. There is already a platform where reagents can be deposited under a certain number. And then, of course, that would only work if all the authors of new papers start to use that same code.
Or if the
And then all the
papers
publishers
insist.
insist using that same code. But it's in very embryonic stage at the moment. It's been introduced only half a year ago.
Amazing that, I didn't understand we're at this point. It's hard to believe. So there were some other questions.
Yeah.
Yes.
I wonder how you actually convolute, this complex network of vendor, brand, and unique antibody. So is it just by looking at the catalog, or how did you do it?
I have to admit, it took me about a month to generate those data, those 3 tables, that slide, in order to do that. Because the difficulty is, you have to go to the individual product sheets and look for the clues that come back on the other product sheets. And particularly when it comes to our products, it's easy. You just look at the sequence of the peptide, immunizing peptide. If you see that back every time again, you know it's the same
So
product.
it's really kind of puzzling it together, right?
It is puzzling
it's by
together,
similarity and some information and similarity of information that you kind of narrow it down and finally nail it down.
We use standard format sentences for describing the antibody and standard format sentences about how it has been generated. These are usually copied and pasted by the other vendors, so that also gives it away. But the QC data can be quite different because one vendor will remove the original data and replace it by their own, and then it looks different. So you have to look into the details of the text to find the commonalities. And then if you have a set of different products and you see, oh, they are all the exact same antibody, then you still wouldn't know who was the manufacturer. But come to me and I will be able to sort it out because I'm in the middle of that world, so I will be most likely able to find out. But yeah, that is the biggest challenge.
In support of your description of your detective work to discover this, having worked for a few large vendors of materials for biological manufacturing, I can tell you the same problem exists in validating and establishing raw materials for what we make at our materials. Like we make cell culture media that's used in manufacturing of biopharmaceuticals. Yes. And our acquiring raw materials, we have the same types of problems where sometimes a distributor even will not reveal the vendor, but will provide information. And sometimes we can tease together, the values from one to another. We can find out the origin. The same type of problem. But our problem is being worked on currently by ICH, defining, for example, there's a new category of materials, ancillary materials for cell therapy uses, because it's in between a raw material and an excipient. It's kind of a quasi-excipient. And then there's a consortium, something 360, that is now beginning to work on pharmaceutical raw materials. Can't remember the name, but so it's going on now in pharmaceutical and biopharmaceutical raw materials, but it certainly has to now go on in antibodies.
One thing that just popped into my mind is the formulation. You can have one antibody, particularly when it is a monoclonal antibody, you can have them in different formulations. And they will use the same clone number, but it could come as a culture supernatant. It could be as a acidic fluid, but it could also be purified from an acidic fluid, or it could be purified from the culture supernatant, from the hibberoma. So you got 4 different formulations. Go figure which one you're using. But and that will all have profound effects on the way they perform in your assay.
Oh, absolutely. Yeah, we can all imagine that. Yes, I'm taking too long. Pardon? I'm sorry. You announce it. Oh, the group photo when? When is it? Right now? Right? Are we gonna have a group photo now?
Yes.
Apparently, we're gonna have a group photo right now, so if we could.